Hi, it's Dr. Eve here and welcome back to my channel. And as promised, I am going to just be talking a little bit about how I got into skin and why I love skin so much. So thank you so much for watching, and I hope that this is informative, kind of also a little bit informal, and lets you know a little bit more about me. So thank you so much, and Merry Christmas if you're watching this obviously at Christmas time. So, as you know, my name is Dr. Eve, also known as Dr. Yvonne, and I am a doctor practicing in the UK, and I have been working in medicine for well over 10 years now. And essentially, it's a very long story, but I got into dermatology in a very roundabout way. So I went to medical school in London, and I did all my medical school training in a London medical school, and I loved it. I really enjoyed my medical school experience. And I actually did quite a lot of things. I got a publication on women's health when I went to Nigeria to do an elective there, and also, participated in a lot of clubs and activities. So some people know me in that way. But then also went on to foundation training. So when I went on to foundation training, which is also known in America as like residency, I went away far into the Midlands, which was not my plan, but that's where I went. And in doing so, I had quite a lot of time to just kind of focus on my training, and there was less distraction because I wasn't in London, and I had to just kind of put my head down and get over it. And in doing so, I did some very general subjects, which is what we all do when we go and rotate around through specialties. But the time was ticking to decide what I was going to do about my further training. Now, anyone that knows anything about me, and not professionally, but personally, knows I'm slightly indecisive about making decisions around food, because I get FOMO, and I will get very upset if I choose bad meal or about what I want to do. So a big career decision about what I want to do professionally was just too much for me. And then a new opportunity came up while I was in training, which was something called broad-based training, which no longer exists in England, but actually apparently now exists in Scotland, that gave the opportunity for you to do 6-month rotations in various specialties. So that was medicine, general practice, psychiatry, and pediatrics. So over 2 years, extending my training, so spending longer than my colleagues in order to spend longer in these specialties after our foundation, so our basic residency, and then go on to make a decision about entering one of these specialties. Now, that was brilliant for me, gave me much more thinking time, gave me a lot of specialty experience. I got very, very specialised in lots of things that I did normally, and I think it was really good for me generally. So I got really good management skills. The only thing is I was still slightly indecisive, but what it did help me to decide to do was to choose a general specialty, because that's what I realised I am a generalist. That means I like everything. I want to be involved in lots of things. I like the variety of medicine, and I didn't really want to be subspecialists. So I actually had a toss up between general practice or medicine. And I knew if I was going to go into medicine, it would be a general specialty. So nothing super specialist. I didn't want to be a respiratory doctor, which they're great, or a cardiologist, which they're great, but that was my personality. It would have been something like acute medicine. And ironically, dermatology wasn't, on the radar. I didn't realize how much I enjoyed it until I decided to make a decision to go into general practice, which my general medical consultants were not very happy about. I had a lot of pushback. People were really upset that I decided not to go into medicine, as they felt that I was really suited to it. But going into general practice allowed me to do everything, and actually allowed me to be able to hone my skills and also do further training. So I went on to some surgical training, and then I went on to do a postgraduate degree. the reason is that while I was doing dermatology, and I had done quite a bit of while I was doing general practice, and I had done quite a lot of general practice at this point. So I'd done some in foundation, and then after my applications, I did another general practice rotation. I realized it's so different. You know, somebody could come in as 80-year-old and then a newborn or psychiatric case or whatever the case might be, and lots of dermatology kept popping up. And I realized I really enjoyed dermatology. So I thought I might go and do a further postgrad degree. So I did. I did put this off a little bit because of the funds, but I went off and did this postgraduate degree in London, and I can hands down say it was the best decision I ever did. Now, can you imagine? Okay, obviously I'm a little bit of a boffin, I'm sure. And boffin to Americans means like just, you know, you like reading and learning. But you can imagine that I did a postgrad degree, but for me it felt like fun. Every time we went to go into lectures in person, it was like a day out for me. I really enjoyed it. I enjoyed my assignments. I enjoyed all the learning, and even the 2-day examination, I really enjoyed the examination process. Or I think it was 1 day actually, but 2 exams on 1 day. I was actually pregnant at the time, so that was interesting, having to break up the exam to go to the toilet. But it was the most fun, and I think that was reflected in the fact that I came out with a distinction. And in doing so, I went on to basically become the dermatology lead in my practice. I had already been starting surgery. I'd already started doing surgery, minor surgery within general practice. And then I just basically became dermatology lead. I'd gone off to have a baby and then came back, pandemic, oh my gosh. And then, you know, basically continued. And then it was the search to find someone who would be able to help me hone my abilities and skills in dermatology. And I found the service that I work for now, and I love it. I absolutely love it. So imagine most normal people going on maternity leave will be thinking about all the time that they want to share with their baby, and I do. I'm looking forward to all the time I'm going to share with my family and my baby and my child. However, I'm going to miss my dermatology patients, and also a lot of the work I do in general practice. I'm really going to miss it because I have a passion for it. So just kind of understanding how I got into skin, that's the main educational aspect. But that's not the only reason why I kind of fell in love or had an interest in skin. So personally, I had my own experiences with dermatology, which kind of popped up several times during my training and also personally in my life. So all the way back in medical school, we had a dermatology rotation, which unfortunately was called Derma Holiday, which basically means that people took that time to kind of just gallivant and not really attend lectures. But I remember meeting some of the coolest dermatologists I've ever met in my life. And this was the thing I found that's the most fascinating. They would walk in and go, oh yeah, that's a diagnosis. And I thought, hang on, I want to know how to do that. That looks like magic. You know, I thought it was amazing. So I thought, okay, well, if that's the case, I want to know how they did this. But again, I don't know why I never followed it up, and I just kind of let it be. But actually during medical school, I started suffering with some abscesses, which just kept popping up, you know. So obviously I was in my early 20s, and I remember one day I went to lectures and I had a golf ball sized abscess under my armpit, couldn't put my arm down. And I think I was in dermatology around that time, and it, you know, I had some investigations done and it didn't grow anything, but it kept happening. And then I, you know, had this silent thing that I was dealing with every month, where I was having like abscesses and boils in my armpits and in my groin. And it's not really something you talk to people about, you know, even if you live with them, you just kind of deal with it silently. Well, anyway, it turned out later that I had a diagnosis, I just didn't know what it was. And that diagnosis is hidradenitis suppurativa, which obviously is a long name, but what that means is a kind of inverse acne, which classically affects the underarms, the groin, but in women can also be under their tummies, and in men, but also under the breasts and things like that. So I didn't have it in those areas, but the armpits and the groin were a very, very common one for me, such that I had several surgeries while at university to kind of drain these abscesses, but they never grew anything, but they just kept on happening. And then later in my life, I went on to say, look, I need to do something about this. I've just kind of, you know, very typical, especially West African mentality of just kind of deal with it and keep moving. I actually thought, no, hang on, I'm a medic. Let's work out what's going on here and try and deal with it. So I was referred to dermatology personally, and while I was working as a doctor, I went on to get treatment in the form of several antibiotics, and then on to further treatments And actually something else worked really well for me, which was laser therapy, which I'm happy to go into in another video at some point. But it was so transformative to me in terms of my understanding of how medicine and dermatology can really impact people's lives. And I had other issues around that time, which I wasn't really that bothered by, but it did bother me, but you know, it wasn't enough to like make me do anything about, like, my skin wasn't the best. But it was, you know, I still had a little bit of confidence in who I was. I just had to wear makeup everywhere I went. And then after having treatment, things cleared up and I started looking good. And, you know, I started realizing actually there's certain things I can do to implement good skin hygiene, good dermatology training and understanding into my own life and those around me. So that's how essentially Dr. Eve Skin, or Dr. Eve, came about. Dr. Eve is actually a nickname of mine, which people have called me for many years. And I think I talked about that in some Instagram video a while back. So if you want to find that, go on my Instagram page at Dr. Eve Skin. But it's something that really I just honed as a passion, and I now love to help and share with. Specifically have an interest in skin of colour, having seen that that wasn't really discussed much in my training or even seen as examples. Thankfully, I did train for the most part of my medical training in London, so we have a lot more variability in people, but specific, you know, talking about what we would expect to see in people of colour or in skin conditions of people of colour was never discussed. So I did a lot more of my own personal training and understanding in that. But I mean, I think I could probably talk forever about why I love skin, but I just wanted you to kind of have a bit of an understanding about who I am, why I'm here, why I love skin. And as someone narkily wrote on my Instagram, I'm not self-promoting. I want to use my platform to be able to talk about issues of skin and dermatology that are important to you, important to me. I know that when I had HS and I didn't know what it was, I searched the internet and actually YouTube for how to fix my problem, despite the fact I am a doctor. So I think we need to have credible resources out there to be able to give people what they're looking for. And also just, you know, people use YouTube as a search engine. So let me be one of those results which is verified and, you know, giving you correct information to be able to help you with your journey when you're trying to look for skin conditions that bother you. I'm going to stop here. I want to thank you so much for joining me on my channel. I do hope you will click like, you will subscribe, and please, please, please tell me about anything else you want to hear about with regards to dermatology, skin. There's going to be some reviews regarding skin products, and there is one coming right up which I really want to talk about because that's also something that I do a lot about now. I work privately and I have an aesthetic background too, so I'm certainly hoping to share some of those things with you. But I want to thank you so much for joining me. Merry Christmas. And if it's not Christmas when you're reading this, well, or watching this, hi. Have a great one and take care. See you later. Bye-bye.